All right. Hello, Fariba. Thank you so much for offering this incredible opportunity for our Wayne State University students. And welcome to all of our Club Med virtual members for partaking in this awesome opportunity. If you all don't know, my name is Fariba Rana, and I'm the president of Club Med Virtual. I will be leading today's session, reading any comments posted in the chat, and facilitating the conversation as we go along. Before we start, I want to remind everyone to maintain proper etiquette and please keep themselves on mute unless Fariba specifies otherwise. If you have any questions, please post them in the chat and we will address them as we proceed throughout the session. A Google survey will be administered for Wayne State University students at the very end of the session to verify your attendance and will close 30 minutes after the session terminates. Please stay on the call for at least 5 minutes after the session is over to ensure that the survey is working for you. This session will also be posted on YouTube in case you are unable to attend or want to revisit certain topics Fariba discusses today, but you cannot receive attendance hours if you are not present in this call and complete the survey. As you all might presume, Fariba is my older sister and by far one of my biggest inspirations. She has been one of the most encouraging and supportive people in my life with regards to pursuing a career in medicine, and I hope you are all able to gain some insight from her as I have been for my entire life.
Oh my God, thank you for that introduction. That was so sweet. And thank you guys so much for hyping me up in the chat. I really appreciate it. So today I'm going to be talking a little bit about my undergraduate experiences and what I think that you guys can do as undergraduate students to really make yourselves stand out. I'm going to be talking about the application process and how admissions works. I'm going to be talking about where I'm at currently in medical school, and then I'm going to go through a really quick case study with you guys. So just to start off, I am an M2 currently at Wayne State University School of Medicine class of 2023. I went to Wayne State University for undergrad and graduated in May of 2019. I currently have a BS in psychology and a minor in biology, and I'm currently super interested in going to either OB-GYN or internal medicine / pediatrics, and I've lived in Detroit for about 6 years now. So my biggest advice to all of you guys is to make sure that you do things that you enjoy and are super passionate about. So one thing that you can do throughout your undergrad is keep a list of meaningful experiences that you're having throughout your entire college career that really solidify your love for medicine and your desire to go into this field. So in my opinion, some of the most important types of experiences that you can have are community service and volunteering, clinical experiences that can be either volunteer or paid, shadowing, extracurricular leadership positions, research, and then it's really important to also have hobbies and interests outside of medicine that show that you're a well-rounded person and you're an individual outside of just medicine. So some of my personal undergraduate experiences, since me and Bisma went through some of the questions that you guys had, and a lot of people were wondering what specifically do people in med school do to get in. So these are just like a list of things that I did personally. So I shadowed an anesthesiologist, and through this experience, like I was able to see like what it's like to really be a doctor day to day. And I was able to see a lot of surgeries, which was really cool as well. And I got to see like what the entire environment was like, and it really helped me solidify that this is something that I really wanted to do in my future. Another thing that I did was I was a research assistant in 2 different labs. I was part of a developmental psychobiology lab and a perinatology lab. So I wasn't really huge on research during undergrad, but the thing is, like, I was really interested in these topics, so it really helped me during my interviews to talk about them. So even if you don't love research, it's important to get some sort of research experience because most schools really want to see that in an applicant. I was also a chemistry and psychology peer mentor at Wayne State, and I think that really helped for my application as well. I was on the board of an organization at Wayne State University called Period, and we basically helped distribute menstrual hygiene products to women and girls that needed it in Detroit. I was also a volunteer patient navigator at Carmano's Cancer Institute and at Cass Clinic. I volunteered with Circle K. I was an ABA therapist for children with autism. And then I also had some creative hobbies that I really enjoyed doing. Like I really like drawing and painting. I like doing henna tattoos. And I really, really enjoy photography. So my biggest piece of advice to you guys is the quality of your experiences matters a lot more than the quantity of experiences. So don't focus so much on having like a million different things that you're doing. Just having a few things that you really care about and show who you are as a person is definitely the most important thing that you can do. So there's a couple questions. How did you get that opportunity? Which specific one? Maybe she's talking about research, I don't know. But for research, basically, like, I just emailed a bunch of different people. So I like looked on, there's a website for Wayne State where you can like look at different professors and the different research topics that they're interested in. So I think it's on the Europe website that I looked at. And you can just see like what different projects like those professors are doing and see what you're specifically interested in. So for me, like, I really love psychology. Like, that's why I was a psychology major. I think it's so interesting. So I wanted to do research related to that. And perinatology, I was also leaning towards OB-GYN as well during undergrad. Like, I really thought about it. So I did that kind of research as well. So both of those labs really showcased my interests really, really well. So my best advice is to just go ahead and email as many professors as you can who are doing research in subjects that you are super interested in. And it might take some time to get back to you. You know, like, it took me about like 2 years for this like developmental psychobiology lab to really get in. I remember I sent an email to them my freshman year of college, and they responded to me in my junior year of college, or yeah, my junior year. So it took me like a really long time to get that research opportunity. So it's really hit or miss. Some people hear back a lot sooner. So it just depends. You just have to try your best and email as many people as you can. Are there any more questions? Oh, how do you get involved into research? Yeah, so just emailing as many people as you can. And the anesthesiologist, yes. So I did have a personal connection to the anesthesiologist. She was a family friend. But I know other people, what they do is they look on like hospital rosters of like the different doctors there, and they just go ahead and email doctors individually, and sometimes you can get some luck with that. But for me, yeah, it was just a family friend. Do we get credits towards our degree for doing research? So for some degrees, yes. For my degree, I did get credit for doing research. So since I got the psychology honors major, we were required to do some research, and we got like 3 credits for that in a semester. So it really depends on what type of major you're doing, but for most majors, I think yes, you can. Can you tell us how you manage your social and academic life along with extracurriculars? That is a great question. It was very hard at times. Like, I'm not gonna lie, like it was tough, like figuring out a good balance. But honestly, I think I had a really good experience at Wayne State. Like, I loved being in the city, and I think being here really helped me have a really well-rounded experience, and I felt very balanced. Of course, like when it came time to exams, like I wasn't really seeing many people and I wasn't very social, but I really like value like social interaction and doing things outside of school. So I think as long as you make it a priority in your life to do other things outside of school, you can really make it happen. I also had a very strict like schedule during undergrad. So like I had like a set study time, and then I had a set time for like going back home on the weekends and spending time with my friends and family. So I think just finding like a good routine for yourself is like the most important thing that you can do. What psychology classes at Wayne State have helped you in medical school? So a lot of them actually, like, they kind of made me into a better studier and a better researcher and better at like reading comprehension and stuff like that. I wouldn't say that a lot of the content in my psychology classes has come up in med school yet. I have yet to see that, but I think, you know, just like the general psychology major classes like really helped me become like a better thinker and a better reader and a better researcher, and got me to think about like complex diseases in a different way. But I think like the most important classes would probably be like introduction to psychology. Intro to psych was really important, and abnormal psychology, because like a lot of the psychology disorders that you learn in that class really do come up in med school. How do you gain patient care experience? Where did you find the opportunity for clinical work? So my patient care experience, I got through Carmano's Cancer Institute. So I was a volunteer patient navigator there. So I just applied on their website to be a volunteer. That was like my main thing. I got like 200 hours of volunteering through that. So that was really cool. The other clinical experience I had was shadowing the anesthesiologist. That was just my family friend that I had. And CAS Clinic, I got to volunteer there through CPM. So Wayne State has a CPM program. I don't know if you guys are familiar with it, but they often send out these opportunities to do like shadowing and, volunteering at really cool places. So I just signed up through them and I got to go to CAS Clinic a couple of times. So that was really cool. Have you done any scribing? No. So that's something that I wanted to bring up too. A lot of people think that you have to do like a scribing job or like some sort of like medical related job to like get into med school, but you really don't have to. It can be paid or volunteering. And scribing, I never felt like I had enough time for it, and it felt like too much work. And I had friends that did it, and it was really, really tough for them to deal with the hours and like have no breaks or anything. So I decided personally not to do scribing, but I know that it does help with med school. A lot of my friends that did scribe, they had an easier time in med school, talking to patients and getting like a history and stuff like that. How many hours did you get through shadowing? I got about 100 hours of shadowing, but it varies. Like no school has like a specific number that they want you to hit. Just as long as you've shadowed enough to where you feel like you can talk about it, that's like the most important thing. Does having a LinkedIn help, or is it more geared towards non-STEM majors? I don't have a LinkedIn. I don't think it really helps with our career choice, but I think for like non-STEM majors, like business majors and stuff, a LinkedIn would be like more important. Do you think there's research opportunities currently, or would we have to wait till this pandemic is over? It's definitely a little bit more limited now because it's hard to go in person and do research, but I think that there are some things that you can do online, like you can help write manuscripts or write abstracts, and I think it just depends on what type of research it is, but you definitely can't really do a lot of clinical research right now or like a whole lot of bench work, but I'm sure that you would be able to help with like writing something or maybe just like doing like data analysis at home. Why do you want to become a doctor? I think I will touch on this more throughout the presentation. I think we can continue and
Yeah, I agree.
Answer some more of these questions throughout. So my application cycle, so I started reaching out to professors and asking for letters of recommendation throughout my junior year of college because I knew that after my junior year is when I wanted to apply to med school. And I worked on my personal statement throughout my junior year, and I really thought about why I wanted to do medicine during my junior year and did a whole lot of like self-reflecting and, figuring all that stuff out. My reasons for going to medicine are, I could talk about it for like forever, but like some of the biggest things is our little brother, me and Bisma's little brother, has ulcerative colitis. And ever since I was little, I was really interested in learning about why like he has this disease and, doing research on my own. And through his experiences, like I got to be in the hospital a lot and like talk to doctors. And, I was only 12 years old, but it really, really piqued my interest. And I knew that I wanted to be a doctor someday so I could help people like my little brother. That was like one of the biggest things. I just really enjoy like my classes that I took at Wayne State, like human physiology, biochem, I thought were so interesting, and just learning about the human body in general. And then of course like the biggest thing is like I wanted to help heal people and make people feel better. It's a cliche answer, but it's so true. Like I think being in medicine is like one of the most rewarding jobs that you can have, and you're always constantly learning, you're helping people on a daily basis. And it's just, for me personally, it was like the best career choice. And I knew from a very, very young age that I wanted to do this. So anyways, I took my MCAT in the middle of May of 2018 after my junior year of college. Then I got my score in mid-June and I was really happy with my score. So I decided to submit my AMCAS primary application and the DO school application in mid-July. I wasn't really sure if I wanted to do MD or DO, so I decided to do both. I started to receive secondary applications in August, and then I submitted them within 2 weeks of receiving them approximately. Then I interviewed at Wayne State School of Medicine in late September, and then I was accepted to Wayne State in October of my senior year. So I did go straight from undergrad to medical school. Let me see if you guys have any more questions. How long did you study for your MCAT? I would say like dedicated study time, like just MCATing mostly, would probably be like 2.5 months, but I did study for it like throughout my undergrad. Throughout like sophomore and junior year, like I had like those MCAT books and like I would just like skim through them a bit just to see like, you know, what the MCAT was. But I think like 2.5 months is when I really studied. Do you have any tips on letters of recommendations if you weren't able to go to office hours that much? So I like before going into a class, like I kind of would be like, okay, I need a letter of recommendation. So I need to build like a relationship with this professor. So I would force myself to go to office hours to like get to know the professors better. Because I don't know like how easy it would be to get to know a professor if you don't go to office hours. That being said, I do know people that got letters of recommendation without going to office hours, and they just got like a really good score in that class, like an A. And that professor said, if you get an A, then we'll write you a letter of recommendation. So I think it really depends on the professor. Some professors will refuse to write you a letter if you didn't go to office hours. So it really just depends on the person. But if you weren't able to go to office hours that much, maybe like I would try emailing the professor and, you know, trying to ask questions. I would do this thing where like I didn't really have any questions in class, but I would like make up questions just to like, you know, get a better relationship with the professor and so that they could get to know me a little bit more and we could start having a conversation. So I think especially with COVID-19, it's really hard to like get that face-to-face interaction. So just like maybe emailing or reaching out to your professor for advice, like anything that you can do to build that relationship. What are some good study materials for MCAT? So I personally use Princeton, but I know Kaplan is very good too. They have like these book sets of like 7 subjects or whatever, and they go over like all the MCAT subjects in those. And then the AAMC, which is a company that makes the MCAT, they have some really good materials like practice exams, question banks, section banks, stuff like that that you can do. So those are like the top 3 things. So Princeton, Kaplan, and the AAMC material. And then also I did Next Step. Next Step is a program where they have some like exams that you can do. So I think I did like maybe 4 or 5 practice exams through them. What's the difference between MD and DO? So honestly, not a lot. Like they're becoming pretty much the same like over time. The only difference is DO, they have like this extra training called osteopathic manipulative medicine, where they learn how to like use your body's innate capabilities to heal itself. And it's kind of like chiropractic in a way, where they like kind of align your spine and align your muscles and everything to help your body heal itself. So like they just have like an extra class that they do. Unfortunately, there's like the stigma that DOs aren't as like, you know, accomplished as MDs, but they really do the same, if not more work than we do. So I don't really know why that exists. And DOs also focus more on like holistic medicine. So they look at like an entire person rather than just treating like, you know, symptoms with like medicine or whatever. They look at like the whole person, but MDs should technically be doing that too. So there really isn't like much of a difference. What was your science GPA? To be honest, I don't really remember the exact number. I think it was like around a 3.8. And then I think my overall GPA was like a 3.92 or something. Did you feel overwhelmed when studying for the MCAT in classes? Yeah, definitely. But the semester that I did take the MCAT, I kept it pretty light. I was just taking genetics and a psychology course, so it wasn't too bad, but it definitely got pretty overwhelming when I was taking finals for my genetics class and MCATing at the same time. It was definitely a lot. Is Anki a good tool to use? I hear lots of med students use it to study. So I personally don't really learn from Anki that well. Like, Anki just doesn't work for me that well, but I do know that a lot of people use it, and a lot of people use it for the MCAT too. But for me personally, I just don't like flashcards, but it just depends on the person. Can we get recommendation letters from doctors at a clinic that we work at? Yes, yeah. So you can get it from doctors, your employer, professors, like anybody that has seen you grow and is able to advocate for you and talk to you. Okay, next slide. Okay, so this is my general advice for the entire application cycle. So start working on your personal statement early. So your personal statement is a super important determining factor for admissions, and it's pretty hard to, write out in words why exactly you want to do medicine. So it's really important to start thinking about it early and, just jotting down ideas of things that you can talk about. Because when it comes time to actually write it, a lot of people are really stumped on what exactly to say. So submit things early and on time, but make sure you're happy with your final submission and you're proud of your work. So I remember feeling like pretty rushed when I was submitting my applications, and people kept telling me like, oh my God, you're so late. Like, you're probably not going to hear back like super soon or anything. But ultimately, I'm really glad that I took my time because I was really proud of the work that I put in, and it got me to where I wanted to be. After you submit your primaries for a school, do some research on either Reddit or Student Doctor Network to see what secondary essay prompts that school has, so you can start working on them early. So after you submit your primary application, it takes like a little bit of time for them to send you your secondary application. And once you get that secondary, you have to submit it pretty soon. So what you can do is start working on them early by looking up the prompts online. So that's something that I did, and it was really helpful. Another piece of advice is just be patient and relax if you don't hear back right away. Application cycles don't always go in like a logical order, and you never know when you'll hear back. I have friends at Wayne that got in like 2 days before classes started. So you honestly never know when you're gonna hear back, and just, don't panic and just go with the flow of things. I know it can be really, really stressful, but, just have faith in yourself. Practice interviewing with a friend or family member to get used to talking confidently about yourself. It's okay to humble brag a little bit. You worked hard to get here, and make sure that you're able to talk about your experiences in a way that's confident and, just honestly be strong in everything that you say. My last piece of advice is that it can be really stressful to wait for scores and interview invitations and secondaries. Just make sure you're taking care of yourself. Your mental health and well-being is the most important thing at the end of the day. So I had a question. How many medical schools did you apply to? So this is a great question, and it ties into my last point. So I initially I sent primaries to about 15 schools. And once all those secondaries started coming in, I was really burnt out. And I was like, I cannot do all these secondaries, and I don't even want to go to any of these schools. My main mission was to go to Wayne State. Like, I always knew that I wanted to go to Wayne State. So I decided to not do secondaries for those schools, and I only did secondaries for the schools in Michigan. So I did one for Wayne State, for MSU, for OU, Central, and U of M. So those are the ones that I sent my secondaries to. I heard back from Wayne State on October 16th, which is like the first day that you can hear back from a school. And I was just so excited that I got in. And so I withdrew my applications from everywhere else. And I was like very, very set on Wayne State. Were any of the medical schools you applied to out of state? Yeah. So I did apply to a lot of out-of-state schools, and I was like, you know what, I don't want to go to any of these. Like, I really wanted to stay close to home, and out-of-state tuition is so expensive. So it just did not seem worth it to me, and Wayne State was my number one go-to school. So this is just like a little bit about my medical school life. So in that first picture, that's me with my anatomy group. So in medical school, you basically get to be in an anatomy lab, and you get to do dissections on a cadaver, which is a dead body. So it was pretty crazy at first and like hard to get used to, but I made these awesome friends and we got through it together. And you know, like honestly, as tough as medical school is, and like you guys might think it's just all stress, the people really make it worth it. And the people that I've met here are honestly amazing. And I still have time to have fun and, you know, just be myself. So like in that top picture of me and my friends in dresses, that's us at our med gala. So Wayne State has like a med prom kind of thing. So that was super fun. And I know a lot of other schools do it too. So I just wanted to show you guys that, just so you know that med school is not all just studying all the time. A lot of people think that like, oh my God, like if you go to med school, you're wasting your 20s, like you're just going to be studying like 20 hours a day. It definitely is not like that. You guys can even ask my sister, like she sees me, like I wake up at like 11 a.m. Like, you know, I have a pretty relaxed lifestyle for the most part. Until exams times it gets like a little bit stressful, but it's really not as bad as a lot of people may think. And in that bottom picture, that's me giving a flu shot. So that was through a really, really cool organization that we have at Wayne State called Street Medicine, where basically we go to homeless individuals, we go to homeless shelters, and we give them medicine, immunizations, you know, do a basic like history and workup on them. So that was a really cool opportunity, and I'm really glad that I chose Wayne State, because I don't know if I would have gotten the opportunity to work with Detroit's homeless population if I didn't go here. And then that middle picture is my first day of my M2 clinics. So something that's really cool that I'm doing right now is I'm working alongside a family medicine physician, and I get to go into a clinic and I get to see patients on my own for the first time. So that was really cool. It's been tough with the COVID pandemic because of course I'm scared of like getting COVID on accident, or, you know, anything scary like that happening. But, you know, I have a mask and they give me an N95 too. So thankfully, so far, nothing has happened. But yeah, that's just my medical school life. So my daily life as an M2 right now, I study about 4 to 8 hours each day. 8 hours is like once it gets closer to exam time. There's no required lectures at Wayne, which is nice, and there's few required in-person school events, especially due to COVID-19. It's kind of dangerous to like hold people in a large setting like that, so we really haven't had to go to school a lot. Like I said before, I'm working alongside a family medicine doctor in preparation for our third-year rotations. So in medical school, once you're a third year, you get to rotate in hospitals, and you're not really listening to lectures as much. You're actually going out and seeing patients and stuff like that. So basically, this whole family med program that I'm in right now is helping prepare me to interact with patients next year. I'm participating in some extracurricular opportunities, so I'm on board for the OB-GYN interest group at my school, so that's been really cool. Like, I've gotten the chance to talk to some OB-GYN doctors, and you know, I'm looking for like some research opportunities in COVID, which has been hard. But, you know, just doing extracurricular stuff and like working for free clinics, that's been great too. And my biggest thing right now that I'm doing is preparing for the USMLE Step 1 exam. So I'm taking it in March next year. So basically, in order to become a board certified doctor, you have to take these step exams. So the first exam that you take is called Step 1. And this is a huge exam. It's probably like one of the hardest exams I'll ever take in my whole life. So it's a really, really huge deal. And for me, it's going to be scored. The year after me, it's going to be pass fail. So basically, the better score that I get on this exam, that means that I can go into some really competitive specialties if I wanted to, like dermatology or radiology or anesthesiology. But yeah, so pray for me, guys. Hopefully that goes well. So my M2 year ends in December, and then we have about 2 months for dedicated step 1 preparation. So I just get to basically lock myself in a room and study for 2 months before I take it. And I've also been having a lot of fun. I've been spending time with my friends and family. I've been exploring Detroit, and especially with COVID, I actually have a lot more free time than I did last year because I don't have to be at school that often. So it's been pretty nice. M2 has been, it's been very chill. So now I can go into my case study, or unless there's some, I don't know if there's any questions. Oh, thanks for all the good luck messages, guys. Oh, Bisma asked, what's your opinion on it being pass-fail for incoming M1s right now? So it's kind of a controversial thing. So it's good in a way that they're not going to be stressed out about their score or anything like I am. Like people in my class were pretty stressed out about getting a high score because basically if you don't score super high, like that can close a lot of doors for you if you want to do something very competitive. But the bad thing about pass fail, I think, is that it doesn't really differentiate you from other students that also passed. So you have to do a lot more on your application to stand out. So the incoming M1s are going to have to do a lot more extracurricular stuff like research and all of that to showcase like what kind of residency applicant they are. So it's kind of a double-edged sword. It's a good thing and a bad thing. I think personally I would have preferred for it to be pass-fail for myself, but you know, it is what it is. Is there retakes for those? So basically, if you score really low, no. If you score really low and pass, no, you can't retake it. If you fail, you can retake it. I think you can retake it up to like 3 times in a lifetime or something like that. I don't really know. But yeah, if you get like a really low score, you're stuck with it. You can't like retake it to do higher, like how you can do for the MCAT. So there definitely is a lot of pressure. And the reason why they decided to make it pass fail was because they realized like how mentally taxing it is for students. So it's really sad. I don't know if you guys heard, but like at U of M, there was a student that, you know, unfortunately committed suicide, and he was an M1 student. And unfortunately, this is like a very painful reality of our field, is that people are very depressed and have a lot of mental health issues because of how stressful it can be. So the whole reason for them making it pass fail was to kind of mitigate that stress and make it less harmful on students. So that's the whole reason why they did it. But let's see if, you know, it actually helps, or if it's not the move, you know. We still don't know yet. So step 1 determines what specialty you go to. Not entirely, but it is a very, very big component of what specialty you go into. For me, for my class. But with the coming classes, with it being pass-fail, I don't think it will be. Is it pass-fail for all schools? Yeah, it's for all schools. Across the nation, it was just decided. If it is pass-fail, how is it determined who gets to choose something? So we don't know yet. Honestly, that's like the big mystery. I think they're probably just going to look at if you did research, if you did like extracurricular activities and stuff. So it'll be a lot like undergrad, where you have to like do a whole lot to build up your application outside of like just school. How many times can you retake the MCAT? I don't know exactly. Yeah, I'm not exactly sure. Maybe one of you guys would know that. How competitive is OB?
I believe it's 7. Sorry.
7? Okay.
Yeah.
How competitive is OB-GYN? It's like medium competitive. It's definitely not as competitive as like neurosurgery or anything, but it's a little bit more competitive than just being like a primary care physician, like, you know, a pediatrician or an internal medicine doctor. It's like a step above that. But yeah, I don't think it's not like insanely competitive. So I'm not like super stressed about getting like a very, very high score or anything. I just want it to be enough to where I could do OB-GYN. Okay, here's my case study. So basically there's a 34-year-old woman who gives birth to a baby girl with a constellation of birth defects, so basically a bunch of birth defects. And the baby has sensory neural hearing loss, cataracts, cardiac malformations, and purpuric skin lesions. So sensory neural hearing loss is basically when you have hearing loss that's caused by damage to the inner ear or the nerve from the ear to the brain. So there's a different kind of hearing loss called conductive hearing loss, where there's like a blockage that's preventing you from hearing. But this is like a problem with like a nerve or like in the brain. Cataracts is basically when you have opacities in the lens of your eyes. So the lens of your eyes will appear to be white and cloudy. Cardiac malformation called a patent ductus arteriosus. I'll explain that a little bit more in a bit. And purpuric skin lesions are basically like a rash where there's just a bunch of purple spots, like bruising basically. So everybody's really confused. They're like, why does this baby have all these birth defects? So upon further inquiry, the mother recalls that during her first trimester of pregnancy, she wasn't feeling well. She had a rash, she had swollen lymph nodes, she had a low-grade fever, and she also had some joint pain. But she quickly cleared the illness and felt better. So she didn't really think to go to a doctor or anything. She didn't really think it was a big deal. But let's see what happens next. Go to the next slide.
Does anybody have any ideas of what it could be in the chat?
Yeah. Oh yeah, I forgot to ask that. It's a it's kind of like it's a very rare thing, so it's okay if you don't know. It's totally fine. So the diagnosis is the baby has congenital rubella syndrome. So basically what happened was the mother had a rubella infection and passed it on to her baby during the first trimester. So the first trimester of pregnancy is a very, very important time. You have to make sure that the mom's completely safe, and she's not exposed to any toxins or any illnesses or any viruses or bacteria, because it can very easily be passed on to the baby and cause some major problems. So rubella, it's also known as German measles, is a viral infection, and it is one of the TORCH infections. So in medical school, you learn this mnemonic called TORCH, which stands for toxoplasmosis, other, rubella, CMV, which is cytomegalovirus, and herpes. So these are all infections that cause maternal illness during pregnancy, and they can easily be passed on to the baby. And during that first trimester is when the fetus is the most vulnerable to these. So these can all result in some serious fetal abnormalities, miscarriage, or stillbirth. So that's basically what's going on here. So cataracts, so that top picture is what cataracts looks like in a baby. So you can see the lens of the eyes are like really cloudy and white. That middle picture is called a blueberry muffin rash. So these babies are often called blueberry muffin babies because they kind of look like a blueberry muffin. I don't know who comes up with these things, but it's basically because your blood cells, there's something happening called extramedullary hematopoiesis. So normally inside of our bodies, our red blood cells are produced in our bone marrow, in the medulla portion of our bone marrow, which is like the middle portion. So in this condition, basically the red blood cells are being produced outside of there in the other organs of the body where it's not supposed to be. And so that manifests as like this purple rash that looks like a blueberry muffin. Another thing that these patients have is deafness. And then they also have a patent ductus arteriosus. So basically, if you see in that bottom picture, there's a connection between the aorta of the heart and the pulmonary artery. So this is a normal thing in a fetus, but basically within 3 weeks of being born, this is supposed to close up, and it's supposed to turn into something called the ligamentum arteriosum. But what happens in these babies is that this duct stays open, and because of that, the blood is not being properly oxygenated in the body, because in order to have properly oxygenated blood, you need the blood to go to the lungs properly and get oxygenated. You can't have deoxygenated and oxygenated blood mixed together. So that's a huge problem. So thankfully, this is very, very rare due to vaccinations. There's fewer than 5 infants per year in the US that have congenital rubella syndrome. And in order to prevent this, you gotta vaccinate. Vaccinations is the most important thing. So women who are planning to become pregnant should receive the MMR vaccine at least 28 days prior. And women who are presently pregnant can't receive the vaccine because it's a live vaccine, so that can cause some problems. But the biggest takeaway from this is just make sure you, as a future physician, talk to your patients about how important it is to receive vaccinations. Unfortunately, a lot of people don't realize the importance of them, and they get caught up in the side effects, which are extremely, extremely rare. So, that's the most important thing, is make sure that you are pushing for vaccinations, especially something like the MMR vaccine, because if we don't vaccinate people, then things like rubella, measles, and all of that can start coming back up. And instead of having 5 infants per year with this, it can start to go up higher if we have more people that are against vaccinating. So that's everything that I have for my presentation. Are there any other questions?
So since we have 13 minutes left, I have a few questions that I can ask you. What are some of your personal coping mechanisms to deal with burnout?
So that's something that, I'm constantly dealing with all the time in medical school. It's really easy to get burnt out. My personal thing is just spending time with my friends and family. I go home a lot and I spend time with, you, Bisma, and my little brother, and, all my friends. And I try to just, make sure that there's a certain set time for studying and a certain time for having fun. So I try to take the weekends off. And even though I might get a little behind with work, I think it's really important for me to reset and just relax. And I also have a lot of hobbies outside of medicine. I really enjoy bullet journaling and drawing and painting. So just doing little things like that is really therapeutic for me. So I really, really enjoy doing stuff like that.
Do you believe that pre-med students need to center their entire personalities around becoming a doctor? Why or why not?
No, definitely not. I think it's so important. It's interesting because I think the people that do that actually have a harder time getting into med school, because during your med school interviews, they ask you about who you are as a person. A lot of the times they don't really ask you about your pre-med classes or anything like that. It's so important to still have your own interests and be an individual outside of this. It's important for interacting with patients in the future. They want to be able to talk to a human being, like an individual, rather than somebody that's so focused on medicine all the time. And so for example, the doctor that I work with, he talks to his patients about Netflix shows that they like, or golfing, or little things like that. So things outside of medicine are really, really important. So you definitely should not base your entire personality around being a doctor.
Do you have any advice on things students should take into consideration when choosing which schools to apply to?
Yeah, I think it depends on the person and what you personally value the most. I think looking at the mission statement of the school is really important. So for me, I looked at how Wayne State really values underprivileged communities. They really value community service. They had a lot of really, really good things that I was drawn towards. Another thing for me is that it was close to home. The tuition was like the cheapest that it in Michigan out of all the schools. So it just depends on you personally. And if you're somebody that's super into research, for example, like maybe you want to go to like Harvard or Yale or something, like some really big like Ivy League school. So it really just depends on the person.
What are some important things to know before starting medical school?
I would say before starting medical school, just really like make sure that you're a well-rounded person, because it's very easy to get caught up in studying all the time, and make sure that you have these coping mechanisms for how to deal with stress. I think developing those is like really important, and it's something that I wish that I had more time to do before medical school. I find like my friends that took gap years and stuff, they had a lot more time to figure out what works for them, what coping mechanisms work for them. And for me, that was something that I kind of had to like work on during medical school. It wasn't something that I had already set. So I think just knowing that it is stressful, it's a lot of work. It's probably the hardest thing that I've ever done in my whole life, you know. It's a completely different journey. It's very different from how undergrad is, but it's also very rewarding, and I love it too. So um, it's not as bad as people say, but it is very, very stressful. So just making sure that you have those coping mechanisms.
Do you have any advice for students who may have low stats and feel discouraged to continue pursuing a career as a doctor?
Yeah, so I actually have a personal anecdote about that. So I remember my freshman year, I went into one of like the advisors at Wayne State, and I showed her like my GPA and everything, and she was kind of like, like, I don't know if this is really right for you, like, maybe you shouldn't be doing medicine. And I remember feeling like so heartbroken after that. And I was like, maybe I just shouldn't be a doctor or anything. And it was just because I got a B plus in Orgo 1. That was it. And she was like, I don't really know if, you should be doing this. And I'm so glad that I didn't let that get to me, because if it did, like, I wouldn't be here right now. So even if you have low stats, like, or a low MCAT or anything like that, I think just like keep pushing through. If this is something that you really, really want to do, like with all your heart, and you really care about it and you can put in the work, I think you're going to be fine. And there's so many resources out there to help you. If you have really low stats, like your GPA, for example, like you can do master's programs. There's a lot of schools where you can take classes, and if you take those classes, then you can get into their medical school. So for example, Wayne State has a program called the BMS program, where basically you do a master's with them, and if you get a certain GPA in that master's, then you're guaranteed like an interview spot, at least at Wayne State School of Medicine. So doing like a master's program for the MCAT, just retaking the MCAT, and then really just like beefing up the rest of your application. So like doing as many volunteer and community service things, and just other things that you're passionate about that really show, your interest in medicine and why you should be a doctor. So it's not all about stats. I do think that stats, unfortunately, play a very big role, but I think the rest of your application matters a lot too.
Do you have any opinions on doing early application?
On doing, like early decision?
Yeah.
I think like if you're really set on going to a school, it's a great option. So Wayne State has like a early decision program. So I had some friends that did that because they knew for sure that they wanted to go to Wayne State and nowhere else. And they were pretty positive that they had like a solid chance of getting in. And they just didn't want to spend the money on other things. That's another thing I didn't mention, is the application process is pretty expensive. It can cost like about like $100 or so per school, I think it was. Yeah, it was just a lot of money. So that's something that you have to like, keep in mind. Um, So like doing early decision is a really good thing to do if you're super set on going to a certain place.
What were your favorite prerequisites and what were the hardest?
My favorite prerequisites, so human physiology, so like my top class. I love that class so much. For me personally, Gen Chem 2 was really hard. And I took that after I applied, thankfully. So, my grade didn't really matter or anything. I took that like my last semester of senior year. So I thought that was really hard. I thought Orgo 1 was very tough for me. But yeah, human phys I really liked. I really liked genetics. Genetics was really cool. What else did I take? I like biochem. Biochem was interesting too. Yeah, I think those are like the main ones.
Somebody asked an interesting question. They said, does med school look for more volunteer hours or paid hours for patient care?
I think it doesn't really matter. I think as long as you are interacting with patients in some capacity, it doesn't matter if it's like volunteered or paid. That being said, like I think having some sort of volunteer thing is like really good to have too, because it shows like, selflessness and like altruism. Like, you're the only thing that you're getting out of that is just helping the person rather than being paid. But it doesn't necessarily have to be like volunteer clinical. I think, it's okay to have a paid clinical thing. Just anything where you're interacting with the patient and you're learning something, that's like the best thing that you can do.
Do you have any advice on efficient study strategies?
Um, that it depends on the person, but I think just having like a really good routine is like the best thing that you can do for yourself. Setting a time every single day to study, being consistent. For me personally, I like to make my own notes in med school. Like I make like these sheets with like all my notes and everything. Um, doing more active learning. So like, doing practice questions instead of just like, you know, passively listening to a lecture on like 2 times speed or something, just making sure you're actively learning stuff.
Somebody said, how did you keep track of your shadowing and volunteer hours?
That's a good question. So I actually like had like a Word doc on my computer where I wrote out like all the things that I was doing so that by the time it came to apply, like I had all of that all figured out and I could just like, copy and paste it onto my application. So I think either maybe having like a notebook or like a Word doc or your own personal Excel sheet where you put like all the hours and stuff that you're doing, that's a really good idea. Anything that works for you.
How does the community at Wayne State University School of Medicine compare to the community you were a part of as an undergrad? Do you feel closer to your peers knowing that many of you will be working in similar fields?
Yeah, I think it's pretty similar. It's pretty Wayne State thankfully is like pretty diverse, so like I really enjoy that. And I think like it's really nice being around people that are also wanting to be doctors. For example, like part of my extracurriculars is that I'm part of the OB-GYN interest group. So I got to meet this group of girls that were also super interested in OB-GYN. So it's really cool to talk to them about it and, have those like similar career goals. And we all like kind of lift each other up and help each other be good future physicians. So I would say the community here is like very supportive and really nice for the most part. I've heard at other places it can be like really competitive where like people are out to get you, and I honestly have yet to experience anything like that at Wayne State. So I've loved it. It's been nicer than undergrad, I think, because like everybody is so like on the same page. Like we're all like very hardworking and stuff. So like when it comes to like group projects, for example, like it's nice like not having people like slack off. Like for the most part, people are like super into it because we all have like this common goal of like becoming a doctor.
Somebody said, how would medical school verify your volunteering hours?
So when you apply on your AMCAS application, you have to write an email address and like a phone number of wherever you volunteered at. So basically, like, they could potentially like reach out to those people and verify that you did actually volunteer there. I don't know how often they do that, or like if they just do it randomly or something, but yeah, I would say it's pretty hard to like fake it, and it's not a good idea to like, you know, make up hours or anything. So yeah, that's pretty much how they verify it. Anything else?
Does anybody have any more questions? You guys can unmute yourselves or just say it in the chat.
Thank you for liking my eyeshadow, Sonia. Yeah, feel free to ask any more questions.
I have a quick question. Did you ever, you know how you were talking about like your advisor not really motivating you to apply or whatever, and I'm pretty sure that led you to doubt yourself. And I'm pretty sure we all like deal with that. Even when we do good, we don't feel like we're doing, you know, enough. How do you deal with that? How do you overcome that and like motivate yourself to keep going?
It's really hard. You know, I think it's something that everybody struggles with, and even doctors like themselves, like residents that I know, fellow med students, like they all struggle with that. And the most important thing is like just don't compare yourself to other people, and give yourself more credit. You know, you're working hard, and keep in mind your final goal. You know, like I always kept in mind that my final goal in life is to become a doctor and help people, you know, and I don't care what happens. I don't care if anything gets in my way. Like, that is what I'm going to do. And, you know, I just kept that whole mission statement in my head for all throughout undergrad. So even when things went bad, like I had some bad exams, I had some bad classes and everything. I think everybody goes through that. Even in med school, like I've had some really tough exams too. But I think just like getting back up and being like, you know what, like, how can I grow from this, like, failure? And what did I learn from it? And how will this help me become a better doctor in the future? You know, just really, really, really setting your goals and knowing that you want to be a doctor in the future and there's nothing that can stop you.
Thank you so much for that. It was a great session, by the way. Thank you.
Of course.
All right, I think we can end it there. Thank you so much for the incredible and insightful session, Fariba. I really enjoyed how thorough and encouraging you were, and I hope we can have a session with you again in the future. If you would like to post your social media handles in the chat, please feel free to do so. To our Wayne State University students, please make sure you complete the Google survey posted in our Zoom chat summarizing this session to obtain your shadow hours, and please stay on this call for at least 5 more minutes to ensure that the survey is working for you. Thank you all, and I hope you have a great night.
Thank you so much, Fariba and Bisma.
Thank you for coming.